Good afternoon, Colorado, and thank you for joining us today. On Tuesday of this week, we got some very exciting news from the FDA Advisor Group, where the Advisory Committee voted unanimously to approve Pfizer vaccines for 5 to 11-year-olds. This is a group of folks across our country, a demographic that has not yet had access to protection outside of some brave volunteer heroes who volunteered for the clinical trials, and Dr. Bajaj, who oversaw some of those clinical trials, is here to talk about that experience. But we are now waiting for final approval from FDA and CDC, which we expect next week. As the father of a 10-year-old and a 7-year-old, I'm particularly grateful. I know there's a lot of parents out there, and their kids are only weeks away from being protected from this virus. In fact, to show the amazing degree of protection, and I'll get into these statistics a little bit later, the vaccines are even more effective the younger you are. So we currently have 11 kids between the age of 12 and 17 hospitalized in Colorado from COVID. 0 of them are vaccinated. The vaccine is very close to 100% effective at preventing hospitalizations of younger people, right? There are still people in their 70s and 80s who are vaccinated, and it significantly decreases your risk of hospitalization, but there are some that still require it. But it essentially eliminates the risk of hospitalization, very close to 100% for younger folks. So 11 people in our state, age 12 to 17, are hospitalized. It's very sad because none of them need to be hospitalized, right? If only they had gotten vaccinated, that number would be 0. There would be nobody. There are 0 people 12 to 17 who are fully vaccinated that are hospitalized right now. Now, what we want to get into today are the plans for rolling out the vaccines for people aged 5 to 11 to their families, to their parents. We want to be where they are, a number of really innovative community partnerships with dates over the first couple weeks of when it's available. Just as we were eagerly planning for many months before the first doses of the vaccine arrived in December of 2020, we've also invested the last several months in planning to get as many 5 to 11-year-olds vaccinated as quickly as possible. Vaccinating Colorado's younger children is really the next frontier to help end this pandemic. To be clear, it won't end the presence of coronavirus in our state. It will move from pandemic to endemic, but we are not there yet. Somebody asked me the other day, is the pandemic over? When we have 1,100 people in the hospital, the answer is no, it's not, and I'll get into those numbers in a moment. But we will enter a phase where this becomes endemic rather than pandemic, and a key part of getting there is protecting a demographic that has very little protection today, right? There's some in 5 to 11 that had COVID and might have natural immunity for some period of time, but it is a very low percentage relative to the number of older Coloradans who are protected from the highly effective vaccine. I can't wait to get my kids vaccinated. I hope every parent in Colorado does the same. We won't have to worry about our kids getting sick or our kids getting their grandparents, their aunts and uncles sick during a family dinner or get sick themselves. And just as we did with the initial vaccination effort, this is really all hands on deck to deploy the vaccine to protect as many 5 to 11-year-olds as possible. We're partnering with Children's Hospital, Denver and Pueblo Zoos, Basalt Regional Library, Girls Who Run, the Community Hospital in Grand Junction, the Pikes Peak Children's Museum, the Butterfly Pavilion, so many others, right? School districts across the state, we've offered to every school district, if they want to offer it on-site at a school, they can collect the permission statements from parents ahead of time, and we can provide that service. They can also coordinate that with a local provider or county health, but the state is happy to do that as well. We are joined by Dr. Bajaj, the Pediatric Emergency Medicine Specialist and Chief Quality and Outcomes Officer at Children's Hospital. Dr. Bajaj had the great honor and pleasure of serving as the executive sponsor of the Pfizer clinical vaccine trials for the kids aged 5 to 11. I'm so proud of the 253 kids in Colorado and their families who stepped up and said, I want to do my part to end the pandemic and protect the lives of others. And Dr. Bajaj has also, on the other side of the coin, treated some of Colorado's youngest COVID patients, kids who were perfectly healthy, contracted COVID, and had to be hospitalized. And he has firsthand knowledge of how important this vaccine will be for our kids. We're also joined by Deanna Herrero, Deputy Director of the Division of Disease Control and Public Health Specialist. She's spearheading the plans around the rollout of 5 to 11 vaccines in Colorado, the preparations, and of course, Colorado's Chief Medical Officer, Dr. Eric France, who's been part of our COVID response from the very beginning, practicing pediatrician for 25 years. That is his background as well, is pediatric care. So he also knows how important it is to vaccinate Colorado's 5 to 11-year-olds. Before I turn it over to our experts, I want to highlight where we are with COVID in our state and then get into the plans around hospital capacity. We currently have 1,167 hospitalizations for COVID in our state. That's 24 fewer than yesterday, but we remain at a very elevated number. It's gone up several days in a row. It's been hovering at a high number. So you're not seeing 100% of the time every day it going up, but we are at a higher level of hospitalizations than we were 1 week ago and a higher level than we were 2 weeks ago. Thankfully, yesterday it went down. Far too early to say whether that's the start of a trend or just a one-day blessing. I also want to highlight the amazing success of the vaccine in protecting people from hospitalization and death. So for people who are vaccinated, the average hospitalization age is 73. For people who are unvaccinated, it's 57. I also wanted to talk briefly about deaths from COVID. Nobody wants to be hospitalized for 10 days or even 3 days. It's a terrible experience, but the worst outcome is death, and that's what we want to prevent above everything else. The vaccine is very close to 100% effective in preventing deaths in people under 40. So if you take folks that are 12 to 40 years old, in the Delta period, the period where the Delta mutation of the virus really changed the risk factors of the virus and how it spread, July through now, we have lost 31 people who are between the ages of 12 and 40. 31 Coloradans have died. Because remember, if you're not vaccinated, this virus can take you down in your prime. You can be a healthy, athletic 32-year-old, and luck of the draw, you can have a minor case, you could be hospitalized, and yes, you could die. We've lost 31 people in the last few months alone, aged 12 to 40. 30 of them were not vaccinated. So it has killed 30 Coloradans between age 12 and 40 who are unvaccinated. It's killed one who was vaccinated. He had a terminal illness anyway. He had a very medically complex case and a terminal illness. But what this shows is the vaccine is very close to 100% effective at preventing death if you're under 40. Now let's go to the next group, 41 to 59. The numbers, again, couldn't be more impressive. Sadly, we've lost 163 people between the age of 41 and 59 over the last 4 months. Of those, 150 of them were not vaccinated. Only 13 were vaccinated. Now, age 60 to 79, we've lost just over 400 people. 339 were not vaccinated. 80 plus, we've lost over 300 people, and 200 of them were unvaccinated. Now, that is a more impressive figure when you know that the overall vaccination rate of people over 80 is substantially higher than the general population, right? So the fact that you could even find people over 80 that were unvaccinated who died is tragic, first of all. This didn't need to happen. Most of them could have been saved. But it really starkly shows how important the vaccination is, and of course now how important the booster is for people after 6 months, especially for people for whom the virus can be particularly fatal, even if they're vaccinated, 50s, 60s, 70s, 80s. Get the booster. Get it, if you're younger and you work around others. I'm 46. I got it right away. I encourage everybody to get it because the data is just off the chart on how it not only continues your reduced risk of hospitalization and death, but also significantly reduces your risk of transmission to other people. So the reality is we have a high level of cases in Colorado. The virus peaks at different points in different places, not just in our country, but across the world. It is in our region of the country experiencing a peak right now that is very challenging for our hospital capacity. So I want to go through what the tools in our toolbox are in the coming days and weeks, if needed, to be able to address to make sure that our hospitals are able to serve those in need of medical attention, whether it's COVID-19, a heart attack, or stroke. If we can show the slide. These are the immediate tools in the toolbox that, again, we're not implementing them all tomorrow, but I wanted to make sure people know what we can do. And you probably should expect at least some of these to be implemented in the next few days or weeks if we retain this high level of hospitalization. One's already been implemented, I'll get into that. We can and are ready to request a FEMA medical surge team. That helps on the personnel side. We are also, as you know, suffering from a difficulty to attract and retain people. It's been a very grueling time for healthcare workers. That is one area that if we find regional partners that want it. My administration met with FEMA Region 8 regional administrators this week to expedite a potential request for federal medical surge teams to alleviate hospital staff shortages if needed. We're prepared to submit the formal request for federal medical surge assistance if needed, and we're in regular touch with our providers across the state to see if or when that is needed and make sure that can be done in an expedited way. Temporarily stopping cosmetic surgeries and then potentially other elective procedures. There are certain providers that at times are delaying those, but we have no current statewide policy around that. There are still people who are getting everything from knee replacements to facial reconstruction to back surgeries. To be clear, these are things that people need medically at some point. There's a medical reason for them, but they are scheduled ahead of time. If needed, they can be rescheduled a month later. And if that's what it takes to keep our hospital capacity, we're ready to do that in a systematic way. We are also stand ready if needed to reactivate the crisis standards of care under Dr. France's leadership. They were in place for much of the pandemic. They have not been needed the last few months. If they are needed, they will be ready to go back into place as well. We are also looking at a new executive order on patient transfer, also something that existed before, to ensure that no open bed goes to waste just because it's not in your network or system. Again, we're not at the point where that has to occur today or yesterday or even tomorrow, but we might very well be at that point in the next few days or week if the number of hospitalizations goes up. We don't want paperwork or networks or systems that stand in the way of Coloradans getting the care that they need. And finally, one that we are moving ahead with right now, scaling the distribution of the monoclonal antibody treatment. Now, I want to be clear, the monoclonal antibody treatment is very promising in reducing the likelihood of hospitalization when administered shortly after a positive test result, but it is not nearly as effective at preventing hospitalization or death as the vaccine. Okay, so I want to be clear about that. That being said, we want to make this as widely available as possible. And the tie-in to hospital capacity is, here in Colorado and across much of the country, these have historically been administered in hospitals. That isn't necessary to do in a hospital setting. So we want to clear that out of the hospitals. We are launching 5 buses that will be providing mobile monoclonal antibody treatment. We are in conversations with all of our major health systems to move that out of their hospital to their outpatient or urgent care facilities across the state. So there is no reason to use hospital capacity on monoclonal treatment. We can do it through our mobile buses and drive-in, walk-through, walk-out, and urgent care centers across our state. 2 of those buses are launching Monday that we will be providing monoclonal antibody treatments to folks shortly after it's effective, shortly after they are diagnosed with COVID-19. It is most effective at reducing the hospitalization rate and the death rate, but not nearly as much as the vaccination would have. Again, once you're diagnosed, it's too late to get the vaccination. You can't, but you can get monoclonal antibody treatment, and we want to make that as available as possible, especially for people in their 60s, 70s, and 80s who contract COVID and are at risk. So getting back to the 5 to 11-year-olds, we are so excited by this development. The vaccine is backed by our country's leading medical experts. Over the last 19 months, we've seen children bear the brunt of the pandemic in so many ways. There are parents in our state, of course, concerned about kids wearing masks in school and the educational effect of that. The vaccination is the way out of that as more and more kids get vaccinated. There are already some schools in our state that have eased up on the high school side, knowing that most of their students are vaccinated with regard to masks. And this is an important step forward. We've never shied away from bold goals in our state, and we are continuing to focus on vaccinating people of all ages and boosters, right, walking and chewing gum at the same time. But we are setting the goal of vaccinating half of our 5 to 11-year-olds by the end of January of 2022. I'd like to turn it over to Colorado's Chief Medical Officer, Dr. Eric France, to talk in detail about what this vaccine means for our state. And remember, he practiced as a pediatrician for a quarter century. Dr. France?
Thank you, Governor. Good afternoon. Yes, this is an exciting day for pediatricians, for families, for family medicine doctors across the country as we get ready to be able to offer vaccination to children 5 to 11 years of age. The slide we have in front of us just shows you the tracks of the incidence of disease over the last year, since January, by age category. And you'll see the orange line represents children 5 to 17 years of age. Early last winter, in January and February, students were home, there was less disease for children, but after the summer months we find that the cases have risen dramatically. As a matter of fact, it's been a 400% increase in cases in children in August and September compared to what we were seeing in June and July. So there's a lot of need and desire to think about this group of unprotected, unvaccinated children and make sure that we've given them all the protections we can. Next slide, please. Currently, we have almost 1,200 people hospitalized with COVID in Colorado. And as you heard, between 15 and 20 per day are children. While fewer children get severe disease compared to adults, children can still get sick with the virus and spread it to other people. And some children will get sick enough to need to be hospitalized. A recent study published found that the household attack rate from being exposed to a child under 11 years of age is 25%. So children can bring home COVID from school and infect others in the home. That may be a parent or a grandparent who then may be at risk for hospitalization, particularly if that parent or adult is unvaccinated. Vaccines are the strongest layer of protection that we can offer children against COVID-19 and other respiratory illnesses. Vaccinating children will help keep them healthy, help them stay in school, and help make sure they don't spread the virus to members of their family. Getting both COVID and flu vaccines this season, including COVID boosters for those who are due, will help make sure we preserve our state's hospital capacity while keeping our loved ones safe. Next slide, please. Thankfully, the COVID vaccine is safe and works extremely well to keep children healthy. In clinical trials that we'll hear about more from Dr. Bajaj, Pfizer's vaccine for 5 to 11-year-olds showed to be about 91% effective in preventing infection and 100% effective at preventing severe illness. For 12 to 17-year-olds, the vaccine also works extremely well to prevent severe illness. Like Pfizer's vaccine for adolescents and adults, the vaccine for 5 to 11-year-old children is a 2-dose series. Kids will need a second dose 3 weeks after their first. Because younger children have different health needs than adolescents, the vaccine for 5 to 11-year-olds uses a different dosage than the one that already authorized for people 12 and older. It's 1/3 of the dose of the Pfizer vaccine that's been available since this last December. This smaller dose helps make sure that the younger children can be safely protected from COVID-19. Like the Pfizer vaccine for adults and adolescents, the pediatric Pfizer vaccine uses well-researched mRNA technology to help the body build immunity. And the data shows it's safe. More than 2,000 children aged 5 to 11 have safely received a vaccine in the clinical trial. Younger children had about the same side effects as teens and adults, including tiredness, headache, chills. In clinical trials, younger children tended to have milder side effects than people over 12. Most side effects are mild and go away on their own in a day or two. We have fought deadly diseases with childhood vaccines for decades. Now we have the opportunity to protect younger children from COVID the same way. Making sure children are vaccinated against COVID will help keep communities throughout Colorado safe and healthy. Back to you, Governor.
Diana Herrero has been our lead on a lot of the community partnerships that we formed with Denver Zoo, Pueblo Zoo, Boys and Girls Clubs, school districts, children's museums across our state. And it's that infrastructure and partnership that we're utilizing to help make sure the vaccine is widely available quickly to parents of kids that are 5 to 11 years old. To learn more about these efforts, I'll turn it over to Diana Herrero, Deputy Director of the Division of Disease Control and Public Health Response. Diana?
Thank you, Governor. Good afternoon, everyone. We are really excited about this next phase of our COVID vaccination campaign. I am personally really excited about this because my daughter is in this next age group that is going to be eligible for vaccination. Our state has had great success vaccinating adolescents 12 to 17, and we intend to build upon that success. We currently sit 13th in the nation for vaccinating the 12 to 17-year-old age group, where we've had more than 60% receive 1 dose and 54% that are fully vaccinated. Next slide. Just last week, we began placing orders for the pediatric Pfizer vaccine. This week, FDA's advisory committee has made a recommendation to amend the EUA for the Pfizer vaccine to allow for vaccination of this new age group. With the FDA approving that recommendation, we anticipate that decision coming tomorrow. When that happens, CDC will begin shipping those doses out to provider offices nationwide and including here in Colorado. And this will really allow us to pre-position vaccine in anticipation of CDC making their recommendation and approving this vaccine for use in this population. We anticipate that decision to come next week, and we anticipate being able to start vaccinating this age group around November 5th. Next slide. Colorado has about 480,000 kiddos in this age group, and we have a goal of reaching 50% with 1 dose by January 31st. We chose this particular time frame because it took us about 3 months to reach 50% of 12 to 17-year-olds with 1 dose. With the vaccine that has been allocated to Colorado, we have received 171,000 doses in our initial first week allocation. And so that's enough to vaccinate about 30% of this age group with a single dose. Next slide. We are working hard to make sure that we've got at least 1 pediatric vaccine clinic in every single county in the state and in a variety of venues. Pediatric doses will be available at around 384 clinic locations statewide and in a variety of settings, including pediatric offices, retail pharmacies, our local public health agencies, community health centers, as well as our mobile vaccination buses. As with other phases of our campaign, we will continue to focus on equity and ensuring every child, no matter their background or where they live in Colorado, has access to this vaccine. Next slide. So as Governor Polis was talking about earlier, we have entered into a number of partnerships with a wide variety of organizations. There's about 30 listed here on this slide. And we're really focusing on partnering with these organizations to hold a number of events throughout the weeks of November and December. And the majority of these events, we're trying to put them in places where families already are, where they're already going, and holding these events at times that are going to be convenient. So on evenings and weekends for families, so we can make it as easy as possible, and in locations where there'll already be. So museums, zoos, libraries, schools, and other locations. Next slide. Okay. So we have worked on scheduling a number of these events already. We are in the process of finalizing dates and times for other locations as well. And we will continue to sort out the details and make these details available as soon as possible. While our focus, is going to be on vaccinating this new younger age group, 5 to 11, we will also be offering not only the pediatric doses, but we will also be offering doses for adolescents and adults at these events statewide as well. Thank you.
And that includes booster doses. So if the parents are taking their kids in and the parents had it, 7 months ago, 6.5 months ago, they can get boosted right while their kid gets it. Or if they had Johnson & Johnson just 2 months ago, again, you're due for booster 6 months after Moderna and Pfizer, 2 months after Johnson & Johnson. The state and CDC allow mixing as well, so you can get a different one than you originally got. Thank you, Diana. This is a really immense statewide mobilization to get our kids protected. And one of those great partners is Children's Hospital in Colorado. Children's has been a leader in COVID response since it began in March of last year. They're once again rising to the occasion to make sure the vaccine is getting to Colorado's youngest kids. I'm happy to turn it over to someone who's seen firsthand the impact the virus can have on Colorado's children, as well as got to oversee the clinical trials of the highly effective vaccine in 253 Colorado kids and families. Dr. Bajaj is the Pediatric Emergency Medicine Specialist and Chief Quality and Outcomes Officer at Children's Hospital, Colorado, and I'm glad to turn it over to Dr. Bajaj.
Thank you, Governor. Thank you all for this opportunity to be here with you today. As you all know, Children's Hospital Colorado has been a strong partner throughout this pandemic, and we are very excited to be entering this next phase as we help to vaccinate as many kids ages 5 to 11 as possible. As we've heard, there's nearly 500,000 children in this age group in the state of Colorado, and now we have a vaccine that has been shown to prevent serious COVID illness for the vast majority of our populace. I am a pediatric emergency room physician and the Chief Quality and Outcomes Officer for Children's Hospital Colorado, and I've treated numerous children and families who have come into the emergency department with difficulty breathing and other complications of COVID infection. The emergence of the highly contagious Delta variant brought even more children into our hospital, and it became even more apparent that COVID can be serious in kids. Across the Children's Hospital Colorado system, we have hospitalized and cared for more than 2,000 children with COVID since the start of the pandemic. I have cared for children who needed treatment in our intensive care units and then needed intense follow-up to ensure that they could return safely to their normal activities. We've worked closely with our physicians and scientists to create evidence-based pathways and treatment protocols to best care for these kids. Additionally, the mental health crisis that is occurring in far too many of Colorado's kids has really created an added burden not only for these families but for the healthcare system. The collective stress, anxiety, social isolation, and grief has been overwhelming and has really taken a toll. Our children have really been hit hard. And as parents and adults, we owe it to them to do everything we can to work together to end this pandemic. The upcoming EUA approval of this Pfizer vaccine for all kids ages 5 and above is hopeful, encouraging news to this group of kids and their families in Colorado and across our nation. It's important for our community to know that hospitals across Colorado, including Children's Hospital, are unusually busy right now. We're seeing high numbers of kids with respiratory illnesses caused by not only COVID, but respiratory syncytial virus, or RSV, and many other viruses that are circulating. Along with this surge, we're seeing that mental health surge as well. Influenza is likely right around the corner, which will put even more stress on our hospitals, and I really urge everyone to get their children vaccinated for COVID, the influenza, and to make sure your kids don't fall behind on their regularly scheduled vaccines like MMR, which helps prevent measles. The COVID vaccine offers protection from COVID infection and related complications, such as severe disease, hospitalization, the risk of prolonged COVID, as well as MIS-C, or the multi-system inflammatory syndrome in children that has caused serious illness in those kids after being infected with COVID. As an ER doctor and a father, I would hate to have another child suffer from a disease that we know we can minimize or prevent with a safe vaccine. The vaccine is also going to allow children to play a part in protecting their elderly family members and others around them who may have weakened immune systems from conditions like cancer. 2 weeks ago, the American Academy of Pediatrics and Children's Hospital Association declared a nationwide youth mental health crisis. This echoes the declaration made by Children's Hospital Colorado in May of this year. The biggest contributor to increased anxiety, depression, and suicidal ideation is uncertainty and the feelings of hopelessness and social isolation. As more children receive the COVID vaccine, the higher the likelihood that life can return to normal. There will be more opportunities for kids to socialize, gather together, which is critical for normal development and physical and mental health. Since mid-2021, Children's Hospital Colorado has been involved in research to determine the vaccine's safety and efficacy in this age group. Children's Hospital Colorado was the largest clinical trial site in Pfizer's worldwide pediatric COVID vaccine trial. Parents of more than 5,000 Colorado children signed up to be considered for the study, which ultimately enrolled 253 participants. One of our main goals was to mirror the diverse population of our state's kids, and we were able to achieve that goal. We also had children with varying conditions from asthma to cystic fibrosis to autism. I had the honor of being the executive sponsor of this trial at our site, and I feel very confident in the integrity and safety of the trial and of this vaccine. I was also able to witness some of the excited and heroic kids and grateful parents who showed up for their trial appointments. Some kids skipped into clinic. One walked in wearing a lab coat and holding an mRNA book all about mRNA and other aspects of genetics. Others wanted to overcome their fear of needles to help their family, friends, and community. And many kids wanted to return to sports, have a sleepover, or see their grandparents this holiday season. Regardless of their desire to get vaccinated, all of these children and families understood the importance of their contribution to science and history and the value of this vaccine. For these kids and all the kids who want to return to normal, Children's Hospital Colorado is excited to partner with Governor Polis and the state to offer many opportunities for children and families to receive this vaccine. Children's Hospital will be hosting 4 ongoing vaccine clinics run by this Colorado State Health Department. While we await official approval of the EUA for children, we will be working closely with the state to make sure we're ready to vaccinate as many kids as possible ahead of this holiday season. Please pay special attention to the dates, times, and locations provided by CDPHE on their website. This has been a stressful time for parents, for healthcare providers, caregivers, and kids. We've all had to keep up with evolving health guidance and the pandemic's impacts on school, social activities, and everyday life. For those parents or caregivers who have questions or concerns, I encourage you to speak to your pediatrician or family doctor about the COVID vaccine. They can address your questions and help you make the best decisions for your family. We also have multiple parent resources on the safety and efficacy of the vaccines, including frequently asked questions on our website at childrenscolorado.org. Children's Hospital Colorado is honored to play our part in helping deliver the COVID vaccine to our patients and families and local communities. And we look forward to seeing many of you at our upcoming vaccine clinics. Thank you.
Thank you, Dr. Bajaj. This remains a pandemic of the unvaccinated. Look, and if you're under 40 and you haven't been vaccinated yet, just look at the data. This is a deadly virus to you now. You're really rolling the dice if you get it. It's killed perfectly healthy 22-year-olds, 32-year-olds, 40-year-olds. And when you get vaccinated, it essentially eliminates your risk of death from this virus. And that's what the data shows in Colorado and nationally. If you're, in your 40s or 50s, you significantly reduce your risk by well over 90% if you get vaccinated to protect yourself from dying from this virus. And if you're in your 70s or 80s, look, this virus can be deadly to you, even if you are vaccinated, but it significantly reduces your risk of hospitalization and death if you remain unvaccinated. It also highlights the need, especially for people in their 60s, 70s, and 80s, to get your booster after 6 months to increase that level of protection. The data is off the charts on how well and important the booster is for, especially for older Coloradans, but it adds level of protection for people of all ages. After 2 months, if you got Johnson & Johnson, please get a booster, Moderna or Pfizer. If you got Moderna or Pfizer 6 months ago, please get a booster dose to protect yourself. Throughout this pandemic, I've just been struck by the way Coloradans have stepped up to take care of one another. The 253 families and kids that Dr. Bajaj cited is one example, but also delivering meals, shoveling snow for a quarantined neighbor, donating money, clothes, food to those in need. Now, we need to take care of one another by getting vaccinated and getting boosted when it's your turn. We're all in this together, Colorado. Happy to take some questions.
That you laid out around hospital capacity, can you explain a little bit more like what level would trigger those different actions being taken? And then I wanted to ask, those orders are all reactive to hospital capacity. Are you looking at any proactive orders? You've always said that hospital capacity is really your true north. Clearly it's being threatened. So are we approaching that point where you might institute a mask order or a vaccine mandate for people going into restaurants or stores? I think a lot of people are just wondering, what point would that happen?
So what we're looking at this point are the 5 items that are on the list to improve the situation with our hospital capacity. We're already moving forward with number 5 that has a minor impact but no downside, but moving monoclonal antibiotic treatment out of hospitals to mobile clinics to urgent care centers. I would expect that unless cases drop off in the next few days, and that's not something I necessarily expect, I would love to be pleasantly surprised, but unless cases drop off, you will see 2 or 3 of these items go in the next week or so. I don't think they'll all be in place within a week or 2 unless things get worse and deteriorate significantly further. But what we wanted to share with you are the 4 items, the one we're already doing, and the 4 others that are in our playbook immediately if hospital capacity is threatened. We still have space in hospitals. It's tight. There's extra shifts. People are working tough, but we are not at the point yet where we have to, as a state, for instance, ban elective surgery. But we remain ready to do that because there are still patients in Colorado today taking up hospital beds that had that knee surgery, that had that back surgery. And we want them to be able to, and that's great. And right now that's being done on a system-by-system basis. But if we need to preserve the abilities of hospitals to serve everybody in urgent need, we won't hesitate to take that action as we did before to delay those elective surgeries.
Sabemos que ya hay un plan para vacunar a los menores de 5 a 11 años de edad, pero ¿qué pasa con esas familias que aún están dudosas, no quieren vacunar a sus hijos, tienen miedo? ¿Qué mensaje le enviaría usted a esas familias y qué va a pasar con ellas?
Yo soy un padre de niños de edades 7 y 10 y ellos van a ser vacunar muy pronto. El día que es legal, quiero proteger a mis hijos naturalmente. Ahora mismo hay 11 niños entre 12 y 17 en el hospital con COVID. Ahora. Y simplemente no es necesario. Ningunos son vacunados de los niños entre 12 y 17 en el hospital. Es casi 100% efectivo en prevenir hospitalizaciones. Para el lanzamiento inicial, el gobierno federal ha designado 100,070 dosis de la vacuna pediátrica en Colorado. Y estamos incluida una clínica de vacunación en el zoológico de Denver, en los museos, en las escuelas con permiso de los padres. También alentamos a los proveedores a participar en nuestro programa de vacunación de atención primaria. Es muy importante recibir el vacuno efectivo para terminar la pandemia y proteger las vidas. Sí. Padres de niños entre 5 y 11 pueden recibir la vacuna después de el 5 de noviembre, es la fecha tentativa, pero tal vez el 4, tal vez el 6, pero el 5 de noviembre puede recibirlo en su doctor local, también en algunos clínicos y hospitales. También tenemos algunos autobuses móviles y queremos ofrecerlo en el sitio de las escuelas también con permiso de los padres.
Governor Polis, hi, Sarah Flower with KSUT, Four Corners Public Radio. A couple of things. Colorado is not alone in our neighboring states that are in the top 10 of highest COVID cases right now, including our neighbors down here in Southwest Colorado, of New Mexico and Utah. I want you to talk a little bit about that regional approach, and I'm looking at number 4 in particular of one of the action plans for patient transfer, which we really rely on one another down here in Southwest Colorado.
Yeah, if we move forward with that, we would have a discussion with the New Mexico governor and their health team with regard to interstate transfers. Our own authority only extends to our borders. That's one of the tools in the tool shed that we were looking at. And what we've seen really across the history of the pandemic in our country and the world, and what we're seeing now is regional peaks and valleys. And you know, scientists don't know why, and I'm sure grad students for decades will be writing their thesis work, and maybe eventually they'll figure it out. But yes, right now, New Mexico, Colorado, Wyoming, up through the Midwest, Minnesota, are experiencing a peak. These same states, including Colorado, had a lower incidence over much of summer, which was wonderful. Our kids were able to enjoy summer activities and sports and not have to worry as much. But what happened in other states with the peak is happening here. Because of our higher vaccination rate, the peak does not seem to be, nor do we expect it to be, as high as it was in states with lower vaccination rates with regards to hospitalizations. But nevertheless, the situation is dangerous and dire for those who are unvaccinated. So please get protected and get vaccinated. And as we move forward with our hospital capacity strategy, in response to your specific question, we will coordinate with our neighboring states.
Hello, this is Meg Wingeter from the Denver Post. I have 2 questions. I wanted to clarify with that transfer executive order, how that would be different from what the hospitals are doing now with the current transfer center. And also crisis standards of care, you said about bringing those back,
yeah.
But my understanding was those were only used for protective equipment. So are we looking at crisis standards of care for in terms of who gets what types of care, or what exactly do you mean there?
Yeah, I'll turn it over to Dr. France. Are you able to do the first one too, Dr. France, on the transfers? Yeah, so I'll turn it over to him. I would just say we had the crisis standards of care for a big part of the pandemic. That's under Dr. France's authority, and I'll see if he turn over both questions to him.
Thank you. Yes. Yeah, the Crisis Standards of Care plan that posted on our website was updated this last year, March and April 2020, and it has a variety of different components that provides a framework for hospital systems and care delivery organizations about how they can operate during a time of crisis. That includes a hospital crisis standard, which talks about how to potentially triage patients to a rare number of ventilators or ICU beds. We have one on staffing that provides advice on how to use scarce staffing in a crisis period of time. There's one on EMS transport, another on PPE, another on behavioral health, and another on advanced directives. And so I'll be reviewing those and working with hospital systems to determine when it's time to actually activate them again. We did have a number of them activated last fall. They were inactivated once things calmed down in the spring. And seeing the stress on hospital systems, certainly the staffing crisis standard of care is likely to be activated, and the hospital standard of care, where we look at principles by which hospitals can make decisions on triaging patients and using scarce resources, is another one that we'll consider. Regarding the question about the transfer issues, I think there are some regulations in place that constrain or limit how transports can be done. Sometimes one hospital network system will be transporting only within its network system and not into another. So we'll be needing to look more closely at that. The goal, of course, is to be sure that all beds are being used appropriately. When someone's ready to be transferred out of a hospital but isn't ready to be at their nursing home or their home, should they be moved to another hospital for a short period of time and freeing up the first bed for someone who needs it more acutely? That's what we'll be looking through with these regulatory changes.
And I want to make sure you understood where we're at with those. We're not announcing today that these are all being implemented. Number 5, moving monoclonal antibiotic treatment out of hospitals is happening. 2 buses start Monday. We're going to go up to 5 buses moving into urgent care facilities. We will monitor the need for the other 4 on a day-to-day basis, but I would expect that unless there is a precipitous drop in hospitalization, some of those other 4 will be implemented in the coming days or weeks.
Hi, Governor Seth of the Gazette. Can you describe partnerships with school districts for 5 to 11-year-old vax rollout and what kind of buy-in you've gotten from them across the state? Thanks.
Yeah. So we have offered to every school district that we, the state, can support site-based, school-based clinics where the schools can simply collect permission slips from parents, and then we will make that available at that site. School-based clinics can also be supported by local providers and hospitals in the area or the county health department. But the state has made that offer to every school district, and we look forward to filling in additional holes where local resources can't provide those on-site clinics to provide this in as many schools as possible across the state.
Sorry, if I can ask just a quick follow-up. What sort of uptake have you had from districts? I mean, has it been mixed? Have the majority said they're going to?
So we're not announcing any of those sites today, and the initial push is on larger scale sites. So that's why we're doing, Pueblo Zoo, Denver Zoo, Boys and Girls Club, Children's Museum. So the initial push in the first week or 2 are to try to do sites where we can do hundreds or thousands of kids in an easily available way, also offering boosters or vaccinations to the parents. The next phase will include more deployment to the school level. Those are available early on, but we're focused on getting as many kids vaccinated as possible. So we're going with the larger numbers first, but we want to emphasize that, and we hope that school districts take full advantage of the state's support in having site-based vaccination clinics.
Thanks.
This is Erica Meltzer from Chalkbeat. Governor, I was wondering if you could expand a little on what you said about the vaccine being a way out of masking for schools. And then I had a question, perhaps for Dr. Bajaj, about what we've learned from vaccinating 12 to 17-year-olds and perhaps dealing with some of those parent questions to maybe see faster uptake with the younger kids.
Well, the vaccine is very close to 100% effective at preventing adverse health outcomes and deaths from COVID-19 in pediatric patients. It's almost 100% effective in preventing deaths if you're under 40. In Colorado, very close to 100% effective in preventing deaths if you're under 40 if you're vaccinated. So as more and more children are vaccinated, there's the opportunity for school districts to reassess their balance between the other mitigation measures they're taking, given their new level of protection in their environment. I expect that many school districts are eager to do that. They're eager to get kids protected, and they're also eager to move forward with a more normal learning environment. Who was your second one for? Was it Dr. Bajaj? Yeah, go ahead.
Thank you.
My question was lessons learned from the earlier effort that would be helpful here to get faster up.
Absolutely. So the 12 to 17-year-old age group we have now achieved over 50% of those kids vaccinated, and we've learned quite a bit. We've learned they tolerate the vaccine quite well, and as Governor Polis mentioned, they have slightly lower rates of acute side effects than the older population does. There are some very, very, very rare side effects that we have taken care of, including I have taken care of in the emergency department. There's been a lot of press around what's called myocarditis, or inflammation around the heart, also pericarditis, which is around the heart, myocarditis, the heart itself, and extremely, extremely mild, and all those kids have recovered in 1 to 2 days. And I would mention that the frequency of that outcome is so incredibly rare as compared to what we see with natural COVID infection, where those kids get, especially in the context of MISC, their hearts get very, very sick. And I have put a couple of children in the intensive care unit to support their heart function while they are being treated aggressively to help them get better. So we have learned that it's very safe, it's very well tolerated, and that those kids are also avoiding hospitalization just like the older population has as well.
And let me say this another way. For parents who might be hesitating, the risk of your kid developing myocarditis or heart problems is exponentially greater if they contract COVID than if they get the vaccine. And I also want to be clear, COVID will be endemic. Nearly everybody will encounter it, if not this year, next year, or in 5 years. You're going to get it. You want to be vaccinated when you get it. You will live through it. If you are young and healthy, you will very likely not require hospitalization. So every single condition is significantly reduced in risk if you are vaccinated. And this is, again, going to be an endemic illness. It's not like I'm going to hold my breath and it'll be over in 3 months. It won't be. It's here. It will be a viral threat for the foreseeable future and generations to come. You want to be vaccinated. You really do.
Hi, Governor. Katie Pelton with KKTV 11 News in Colorado Springs. Thank you so much for the update today and every day. A lot of parents have been asking us and wondering if the COVID vaccine will now be mandated in schools. Will there be a mandate coming down? If so, when do you see it happening? Also, another question for you. I know you've been talking about these large vaccination sites that we're going to be seeing. Will these young kiddos also be able to get their vaccine at the pediatrician's office? Thank you.
I'll answer the first one first, the second one first. Yes, we have, and actually I'll go to Diana to talk about the pediatric outreach program in a minute, so she'll answer that one. We have enrolled many pediatricians in the state. Check with your pediatrician. If for some reason your pediatrician isn't enrolled, it also will be available after a small delay after the state makes it available. It'll be available at local pharmacies and other sites in addition to large-scale clinics, so I'll have Diana address that one. There are hundreds of thousands of parents in Colorado that are eager and excited for their kids to finally be protected. I'm among them. I have a 10-year-old and a 7-year-old. Many members of our health response team have kids in that age group, and the closer you are to seeing the devastating impact of COVID on people, as we are every day, and handling this as doctors in pediatric wards are, the more excited you are to essentially eliminate the risk for your kids. So we're going to do our best to keep up with demand to make sure that it's available for parents who want it. We're getting about a third doses for about a third of all the kids in the state in that very first week. But that doesn't mean we're going to do our best, but it's not going to be available every site. Everybody wants it at any given time. We hope to make it available to you as quickly as possible. It's one of the reasons we're focused on these partnerships and larger scale sites. It is available in many pediatricians across the state. And we're looking forward to also making that available along with boosters and vaccines for parents on our mobile vaccination stations. And I'll turn it over to Diana Herrero to talk about the partnerships with pediatricians.
Thanks, Governor, and thank you for the question. We've been working with pediatric offices across the state to get them enrolled in the COVID vaccination program. And so this isn't just pediatric offices, this is also family physician offices as well. We've got a number, around 150 or so pharmacy locations that will have this pediatric Pfizer vaccine available. Our local public health agencies, our community health centers will also have these doses, some of our school-based health centers. Right now, we've got around 384 locations outside of the big events that we're planning that will have these doses available. We will be making that information available on our website so folks can see exactly what locations will have doses and where they can go.
Give the website out. COVID-19.colorado.gov.
COVID-19.colorado.gov.
Was that? Thank you all so much. Stay safe, get vaccinated, get protected. Let's end this pandemic together. Thank you and have a good afternoon.